I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on lower eyelid blepharoplasty surgical options. So I did a previous video on this, so you can have a look at it to refresh as to the basics. But firstly, what is a blepharoplasty? Bleph means eyelid, plasty means to change. So anything you do, you can touch your eyelid, that's technically a blepharoplasty. Patients come in and ask for it, but they don't really understand what they're asking for. And many patients get sucked in. Oh, we'll just do a little bit of a nip and a tuck, and then they come in with complications. So blepharoplasty means to change the appearance of the lower eyelid, and the two major approaches is to get rid of the bulging that happens there, that's the fat behind the eye, or to actually rejuvenate the skin and muscle. If the bulge is your primary concern, then addressing the bulge is a less invasive approach, which can be done all different ways, from inside the eyelid or outside. And what it does is it gets rid of the bulge. But please note that it doesn't get rid of everything else. It doesn't fix your skin up, doesn't get rid of excess skin, doesn't reposition the muscle. Yes, you can talk about adding that in as part of getting rid of the bulge, but it's quite tricky to do. If the whole appearance is bothering you, bulging down, blow down on the cheek, droopiness, festoons, sagginess, the lid sagging down, then you need a formal open procedure to lift the whole thing up and reposition it. Of all the procedures on the face, this is probably the trickiest. The lower eyelid is a most dynamic structure, and it will always go down. So to correct it, you really need significant overcorrection, and it's got to settle down in time. Why is that important? Because after surgery, patients will say, oh, it's itchy, and they'll start rubbing it, break the stitches, and it will drop. We have to overcorrect you to allow for your body's healing to pull it down into place. And it takes a minimum of 6 weeks. During that time, you can't rub your face. There's anchor points where everything's all anchored down, and even excessive stretching, opening your mouth, can pull on it and drop the position down. If it goes down, it's very hard to lift back up. The cardinal rule is avoid excessive skin removal. I saw a lady yesterday who had this, and the lower eyelid is pulled down. She was told it was normal, but it's not, and she wants it to be restored. So they're the main surgical options for lower eyelid rejuvenative surgery. I prefer not to use the word blepharoplasty. It's rejuvenation to restore your appearance that is aesthetically pleasing for your age. Doesn't make you look 21 again. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.